Hey, I'm Dr. Waldo Floyd III, hand surgeon at OrthoGeorgia. Boutonniere deformity is a characteristic deformity that can occur in an injured finger. The bones in the finger, there's the metacarpal bone, which is actually in the hand, and then out in the finger, there's the proximal phalanx, the middle phalanx, and the distal phalanx. The bones are really intercalated segments that are supported by ligaments and moved by tendons. There is a tendon that inserts on the dorsum or at the top of this middle joint, the proximal interphalangeal joint, that when that tendon's torn, it can cause the other tendons in the finger to become flexors of that joint rather than be normal extenders of that joint. And when that happens, a characteristic posture in the finger where this joint is bent down and this joint is bent up occurs. And it's got a French term, boutonniere, because the joint actually buttonholes up through the tendon tear. The condition, if seen early, can usually be managed with a period of bracing, controlled bracing, to keep this joint straight and allow the tip joint to be bent down. And often that will correct the deformity and allow a fully functional finger. If a patient presents late and the deformity has become fixed and is a contracture, then the goal is to convert that stiff finger into a supple finger and then try to restore the balance. And that correction can be done with a bracing program. There's also a system where we can place pins in the middle joint and use rubber bands like an orthodontist would use to correct crooked teeth. And then often this boutonniere deformity can be treated with therapy. Rarely we need to do surgical procedures to correct the imbalance in the finger. It's a characteristic deformity that can occur without a fracture, but soft tissue, bad sprain to the finger. So if you jam your finger or develop significant swelling about this joint after an injury, it's a good idea to come to OrthoGeorgia and be evaluated to prevent that boutonniere deformity from developing.